TENS unit. So we have the Intensity Twin Stem 3 is the one that we'll be showing today. You also need electrode pads like these. We recommend a 2x4 if you're doing a larger region. These are 2" by 4", or there's also smaller versions of 2x2 or larger versions. You can buy these on Amazon. We found a 10-pack for $8, or you can buy a larger pack if you want, but they are pretty reusable. The only other thing that you might need is some water to just wet the pads if they're not very sticky. And you also want to make sure that you clean the skin before the treatment if you have any lotions, oils, anything like that that would help it not stick.
There are numerous contraindications, so if you have any of the following diagnoses, then you should avoid using your TENS unit. So, a history of cancer with a diagnosis in the last 5 years, cardiac conditions, circulatory issues, hypo or hypertension, sensory loss, pregnancy or menstruating, your more acute conditions, so like fever or recent illness or infection, skin conditions, or recently applied oils, lotions to the area you're applying your electrodes. You don't want jewelry near the area, and you don't want to do it if you have any surgically implanted devices.
Okay, so for this TENS unit that we're using today, you're going to have 2 channels, and they can get plugged into the top like that. So 1 channel to 1. Great, so now we have both channels connected, and then we're going to connect them to our pads here. So for this, it doesn't really matter which ones you plug in to which, but you can see there's a hole in the end of the electrodes. So we'll just push them together, and you want to make sure these are really well connected with no gaps in between, or your current won't be going all the way through. So we're going to do the same thing with the other channel. So you'll see this better once we get them connected to our patient, but these electrodes that are on the same channel are going to go diagonal from each other, and these electrodes that are on the other channel are going to go diagonal from each other. So we'll show you what that looks like on a patient.
And when applying your electrodes, make sure that they're in good contact with your skin. You don't want any of the electrodes like peeling up on any of the sides. And you're also not going to want to apply it on any area with skin breakdown. So don't put it directly over like a scab or just an infection in general.
And if you have any sensation that feels painful or uncomfortable, it really shouldn't be painful. You should just feel like a light tingling, buzzing sensation. So if it's anything different than that, you should really check your electrodes, make sure everything's connected properly, make sure that you turn the unit off before you adjust those as well.
So if you're using the TENS unit for acute pain, then you can expect more of a distraction from the pain that you're having. And then if you're using it for more chronic pain, so chronic would be pain that lasts longer than 4 days, more of a long-term issue, then you can expect up to 4 hours worth of pain relief after using the TENS unit.
Okay, so if we're setting this for low back pain, you're going to have a quadripolar setup, and we'll show you how to do that. But you're going to select your parameters for chronic settings. So once you get your TENS unit on, this is what it's going to look like.
And you're going to want it to be set on TENS. So once it's actually set on TENS, you press the S for settings. So
you're going to want that to be on the end so it shows that it's normal.
And then that stands for pulse waves. So 200 is for chronic pain. So that's where you want at least 4 hours of pain relief. And then we're on time actually.
So this you can change how long the treatment duration is going to be. It really depends on the patient, but for chronic we're recommending they do 20 to 30 minutes. They can do it every 4 to 6 hours, so that would be about 3 or 4 times a day.
So 200 for chronic pain, S for setting it. And then this number right here is going to have to be 1 through 10, so I put it at 8. And now we're all set. So to actually do the E-stem itself with the TENS unit. We would then place the electrodes on the low back, and then we would turn up our intensity by pressing these up arrows.
So really your intensity, what you're looking for is you want it to be towards the patient's comfort level, but because it's chronic, we want to try to find a muscle twitch response. So when it gets to the muscle twitch response, that's kind of a good intensity for us to hang out for the rest of the treatment. All right, so we're gonna use our 4 electrodes. So it's important to look at the cord of where they're coming off of the unit so that you know where to place them. So the setup that we're gonna do is a quadrupolar IFC setup. So you're just gonna kind of follow the wire all the way to the end. You can see that we have these crossed. So there's diagonal electrodes from the same channel here, and then diagonal electrodes on the same channel here. So what's gonna happen with this current is it's gonna cross in the middle and kind of target all this low back area here. And so then when you turn up, you should be looking for the muscle twitch kind of in one of these areas or surrounding the electrode placement. Okay, so when you're using this TENS unit at home, especially if it's for chronic pain like the settings that we showed you, people always ask how much can I use it. Really, you can't use it too much, but we want to make sure that you give your body some breaks so that you can see if it's actually helping with your pain relief and managing things. So for chronic pain, we recommend 20 to 30 minutes at a time, and then removing for 4 to 6 hours. So that would put you at about 3 to 4 times a day. Some people prefer longer or more often than that, but this would be our recommendation as PTAs. Finally, if you have any questions using your TENS unit, usually they come with like a very easy setup guide and everything like that. So you can kind of follow the step-by-step instructions, or you could drop questions down below and we'll try to get back to you. But best of luck. Hopefully it works out for you.